So what I'm going to talk about today is ways to help us have an easier bowel movement. And the techniques I'm going to use are particularly helpful when you have constipation, and they're particularly helpful if you don't have constipation. So if you do have constipation, what we often do is when we sit on the toilet, we tend to kind of slouch a little bit, and then we tend to have to strain, and we tend to have to push. So if we end up what we call valsalvaing and closing off our throat and trying to increase that intra-abdominal pressure in order to release the stool, that ends up tightening up the pelvic floor muscles, which tightens around the anus, and it actually makes it harder to pass the stool. So what we recommend is using something called an open glottis technique. So instead of closing off your throat, you can use, and I would actually recommend trying these different sounds at home while you're actually on the toilet. So instead of closing off your throat, you want to try saying ah, or you can say grr, oh, shh, or make like a little, almost like a bugle out of your fist, an open hand, and blow. Usually a favorite when we're out in public. So when you do that, you can imagine a beach ball in your belly and like you're trying to push it out as you're trying to increase that pressure to get the stool out. But again, you want to do it with the open throat, and that actually helps release the pelvic floor muscles. It helps open the pelvic outlet and allows for an easier elimination. So it kind of looks like this. Ah, or now the actual posture that your body's in really makes a difference too. So there's a reason why in many countries people actually have a bowel movement while squatting or have a baby while squatting. That position tends to release the pelvic floor tension and open up the muscles around the anus. The part that's helpful for that is when the hips are bent and flexed greater than 90 degrees. And the toilets here don't allow for that. So you can use a stool. There's a squatty potty that I have underneath me here. And what you're gonna do is you're gonna sit on the edge of your toilet. You're just gonna place your feet on either side. And notice how my knees are above my hips. This is the position that you want. But you don't just want to lean back and kind of round the spine. You want to try to sit up, have a nice straight spine. Most people find it helpful to let their elbows rest on their knees, and just think about having good posture. Then you want to relax your belly, and you can now try the breathing open glottis technique. And what you'll find is sometimes even just sitting in this position for a minute, waiting for the urge to come, and then when you feel it ready, doing the breathing technique, it really helps to facilitate a much easier bowel movement.